This video animation will introduce online pharmacies, provide some background about their history and current use, and assess the pros and cons associated with the patronage of online pharmacies from a patient care perspective. So what is an online pharmacy? An online pharmacy is a pharmacy that operates over the internet, receiving prescriptions and dispensing medications via direct shipment to patients. Historically, before internet access became a common household commodity, mail-order pharmacies provided this service. Mail-order pharmacies are now considered by many to be synonymous with online pharmacies due to their degree of overlap and the fact that most online pharmacies operate by mail, phone, and online to serve the broadest range of patients. Online pharmacy service is in contrast to the traditional brick-and-mortar pharmacy model, in which patients visit a physical pharmacy location and interact with a pharmacist in person to obtain their medications. While prescription mailing has been available for over a century, it was originally conceptualized as a method of supplying patients in remote or rural locations, with community or hospital-based pharmacies mailing the drugs themselves. It was not until the 1940s that strictly mail-based pharmacies came onto the scene, primarily to provide prescriptions to the substantial VA patient population. For-profit mail-order pharmacies followed in the 1960s, expanding in number throughout the next several decades. To illustrate their rapid expansion, let's look at a comparison figure. Mail service pharmacy sales amounted to under $100 million in 1981, but had reached $1.5 billion by 1989. That's a 1,500% increase in under 10 years. The late 1990s and 2000s ushered in the era of the internet pharmacy, with use continuing to expand. In fact, the National Association of Boards of Pharmacy has reviewed over 10,000 currently operating online pharmacies. Unfortunately, according to John Henkel of the US FDA, reliable annual data summarizing online pharmacy sales are not yet available. While the present-day quantitative impact of online pharmacies may be difficult to discern, we can certainly evaluate their qualitative attributes, especially as they compare to traditional pharmacies. First and foremost, online pharmacies can provide patients with significant cost savings. In fact, some insurance providers require their patients to use online pharmacies to refill maintenance medications due to the reduced cost of ordering a larger amount of drug from a cheaper supplier. Patients without health insurance may derive the most direct financial benefits of online pharmacy pricing, as they do not have an insurer-derived formulary with normalized copays. Another benefit of online pharmacies is the convenience of their mailing programs. Patients with limited mobility, lack of transportation, or even just a busy schedule can have their medicines shipped directly to their door. In the same vein, patients may appreciate the privacy associated with having their drugs mailed, which can avoid potentially overheard conversations about their health or medicines in a traditional pharmacy. However, there are major concerns associated with the use of online pharmacies that must also be considered. While some online pharmacies offer pharmacist consultation via phone or internet chat, others do not offer direct pharmacist communication. As a result of these missing or limited pharmacist interactions, patients may misinterpret their dosing instructions, miss out on important counseling advice, and may be at risk for a drug-drug interaction that would have been caught by an in-person pharmacist medication review. The other primary concern with online pharmacies is the prevalence of illegal or rogue pharmacies that are often indistinguishable from legitimate online pharmacies to the average consumer. These dubious pharmacies may provide incorrectly selected or dosed medications and erroneous or incomplete patient instructions. In addition, patients can purchase prescription drugs without a prescription through rogue pharmacy websites. Whether this is done intentionally or not, this practice can have disastrous medical consequences, since the patient's healthcare provider team will likely be unaware of this medication and may prescribe duplicate or contraindicated therapies. In summary, online pharmacies exist to provide patients with prescriptions ordered on the internet and shipped by mail. They provide an alternative to traditional location-based pharmacies and can offer convenience and cost savings to patients. As we have mentioned, however, there are critical patient care concerns associated with online pharmacies that we will now explore further.